Hi, my name is Margaret Atieno. I'm a licensed emergency medical technician. I was born and brought up in Siaya County, and I'm the founder of Harmony Health Care. So Harmony is an offshoot of SCODI, that's Sustainable Community Oriented Development. So Harmony, we are passionate about lives. So the reason why we founded this Harmony, the foundation was based on poor structured healthcare facilities in the area, lack of defined emergency care system, and an existing trained emergency personnel, which has led to several disabilities and premature deaths in the area. So as Harmony, we are just here to try to solve this situation. So in Siaya, the challenges we have are we have few hospitals. The hospitals we have are really not enough to serve the community. And the few hospitals we have, again, they are poorly equipped, such that we cannot perform major surgeries. We cannot do some lab tests. So normally we are forced to go out of Siaya. Sometimes we are forced to go as far as Kisumu to do these procedures. And in which this way we need transportation. And so unfortunate, in Siaya we don't have safe means of transportation or transporting our patients, especially the very ill ones. The only option we always have are the border borders. So you can imagine taking someone in severe pain in a border is really not worth it. And then we use wheelbarrows. Mostly we use personal vehicles for the people who can afford them. So we have few ambulances, but again, the few ambulances, most of them are not well equipped. Some don't even have just minor medicine like oxygen. So in this case, we endanger the life of our patients. And again, the hospitals are very far, the ones we are using to transfer. So in this way, you find that some people are giving up. Like some, if they just the connection and everything, you find someone is just giving up, or some patients, they are like, no, just let me just take me back home. So they are taking back home to die premature death, not because the disease could not be cured, but there was no better place of doing it, or the procedure was too long for them. And again, mostly we use public transport to transport our patients. And in most cases, some owners of the transport, of the private transport or public, they are not comfortable carrying very ill patients or bleeding patients. So by the time you get the right person, it's taking time, meaning the recovery time is shortened. And this way we lose people, we lose lives prematurely. So this is why we are here as Harmony to solve these problems. So for instance, David was a young man aged around 30 years. He met his accident on Sega-Yenga route when he was just about to arrive in Sega. So when David got an accident, he collided with another motorcycle which was carrying iron sheet. Bad enough, the man did not indicate he was carrying iron sheet. So the iron sheet cut David's leg, which was a really very bad cut. So the distance from the accident scene to the hospital was just about 1.5 kilometers. But nobody knew what to do about the trauma. Nobody helped David, so he bled. By the time he was arriving at the hospital, David had already lost his life due to excessive bleeding. So another case, we had Eric. Eric was assaulted one night in the middle of the night around 1 a.m. So good enough, the family somehow managed to reach in the hospital using a border. So when they arrived, unfortunately, they were told they had to wait for the doctor until following morning. We didn't understand what happened because the hospital runs 24 hours, but he had to wait until following morning. No one was to provide first aid care. So luckily there was a watchman, a kind-hearted watchman, who sneaked out some bandages and helped David to arrest the bleeding because he had very bad cuts on the head, body and everywhere. So the watchman assisted David and luckily his life was saved. He survived. So like in my case, when I was pregnant with my child, that was 18 years ago, I had a colleague also who was pregnant. She was Veronica. So Veronica was to give birth 2 months before me. And Veronica was expecting twin babies. And when she went to the hospital, when the labor came, she went to the hospital, the nearest hospital. Unfortunately, she developed complications. So when they were she was given a transfer, but she was trying to maneuver her way to the hospital. She was using her own means because there was no ambulance in the hospital. She lost her life on the way, which was so unfortunate. So this one scared me so much, just that when my time came, that booked to the hospital, I had an hospital of my choice, and I was not sure if I was going to make it to the hospital. It was a bit far, around 30 kilometers away from my home. So I had to ask a friend to move to a friend's house so that I could stay with her. At least it was near, I could easily access public means, and it was a small town center in our area. When my delivery came, my date came, it came in the middle of the night. So I had no choice. I was only there with my friend, so we could not get a means of transport. We could not. Getting a vehicle would mean I wait until the following morning to get public transport, because we were not sure about my fate. So we had to go to the nearest hospital, which also had no ambulance and it had no theater. But fortunately, I delivered well. So following morning, I was holding my baby. So as Harmony, we believe we have so many Eric, David, and Veronica out there who really need our support. They really need our help. They've lost their lives. We believe there are so many people losing their lives out there prematurely. He will be helped if there was some help, if there was even just minor knowledge. Like in the case of David, if somebody could have just known how to stop this bleeding, I believe maybe he would have not died. I believe if we could we have the basic knowledge, if we could have good facilities, and in our hospitals, like in the case of Eric, if it was not for the watchman, the good-hearted watchman, maybe he would have also lost his life. So from the region, from the look of the things, it's like we don't have emergency team on the ground. So the patient is brought, nobody knows what to do with the patient. So they are there observing him, waiting for the doctor until the following day. For Veronica, if we would have some good means of transportation, we believe Veronica would have reached the hospital safely. So we just believe if we could come up as a society, train people basic emergency training, and the hospital, we can give the training. I think we believe we can save a lot of lives. So Harmony organization, majorly we target the community for us to address the problems. So one of the people we target here are the borders, the motorcycle riders, because most of the times we find that the victims of the accident, that the victims of the situation most of the times, and in many times I say like, can I say like in my region, they are the only transporters, they're the only people who can reach down into the interior to pick our patients, they're the people we mostly use to pick up the patients, transfer to the hospital. And we really want to target them because sometimes they go pick a patient, sometimes the situation, if the person had a training, we believe if it was something that he could handle, maybe just a major bleeding, minor bleeding, he could just handle, do some just first aid before taking the person to the hospital. Because in that, just the short management that he does can just save a life. Or maybe perhaps there's something like a heart attack. We believe if the person, the boda who has been called, has some basic knowledge, he can do something before this person is transferred. Instead of taking the person to the hospital, that time taken can make a difference in life. Again, we target boda because most of the time they're the first people to reach the scene of the accident. Any accident that happens, they're always the people to reach that scene. But unfortunately, they are there, they just stand and watch. There's nothing they can do. So if they had the basic training, we believe they could really save so many lives. If they could have maybe just some few gears, maybe let's say gloves, we believe they can save several lives. When it comes to schools, in schools, there are so many things happening, so many accidents which are never realized by even the adults or the students themselves until it gets late or until when something happens. So there may be some future conditions which can be managed, and maybe teachers or other people might not know. So with Harmony, we just go to the route, to the schools, we train first aid, basic first aid to the students and the teachers. Because if something happens, the very first people who will be there will be the students themselves, the teachers themselves. So it's good if they can handle the situation before the victim is taken to the hospital. So we really target the school. And again, beside these students, they come from our communities, various places. So once they are trained, they can take back the training to the society. They can again just head back in their community to save some lives. As an organization, we just realized in Siaya, most of our hospitals, they don't have trained emergency caregivers. So like in one of our cases, we saw there was a patient who was taken to the hospital. No care was given. They were there watching the patient. So if these people could be told the importance of first aid, the importance of an emergency, rushing to save someone, the time limit, the wasted time, it could be good. So we are targeting the hospitals so that we can give them the basic training, BLS, they know what to do. Perhaps they didn't do it because they didn't know what to do. So we really want to train these people, to bring to their attention what it really means. It really means to handle something, to handle a situation as it comes. That's why we target the hospitals too. Another group we are targeting is the society, the community as a whole. Like we find back at home, like not almost everybody, they don't know what to do with an emergency. When emergency arrives, a child has just been cut or severe nose bleeding or anything, they really don't know. Someone has collapsed, they don't know what to do with the person. So the only thing they think of is to call for help so that someone can be taken to the hospital. But we find that some of these things are the things that we can just manage at home. Something like bleeding is something we can just manage. Snake bite, if someone is aware of what to do, we can save life. And we just want the whole community, the whole society to be aware of what to do. And when it comes to emergency and safety, we want to train them. We have to train them, you have to do this, to take care of themselves, so that again, we don't wait for the emergencies to happen, we can again prevent them. But only if the whole society is trained on them. And we believe the society will really make a change by our training. now that we are down on the ground. So as an organization, I can say we've really achieved a lot. We've managed to reach schools in the rural and the entire community. And I can say our results has been good. The results are positive because we've been getting positive feedbacks. They've been calling us to go do more trainings again. And from then other schools are also copying the same. So far we've got several invitations so that we can go do them first aids. And from the feedback we are getting from the teachers, the students, the trained students, they've at least managed. They can really manage. They are managing to handle emergency situation when it comes, which to us is a positive thing. Again, we've managed to reach several groups of border borders, and that's really a great achievement to us because we've gotten some feedback. They feel that we're trained, have finally managing to tackle the situation on the ground. So to us, that is an achievement, and we hope by more training, they are going to be just good on the field. And considering we are providing them with gloves, it's now easy for them to handle maybe a bloody situation without fear like they had before. So it's a nice idea so far. Okay, again I can say we've made some good steps because right now we have our office and training facility construction ongoing. So we hope very soon it will be completed, and at least we'll have somewhere to settle, somewhere that we can now coordinate our activities, which we really have hopes that very soon it will be okay. So far as organization, we are still asking for the support for the community, society, or anyone who is willing, because we really need to reach more people. We need to complete our office. For now, much as we are using border borders, if we really get an ambulance, it could really help us. It could be of much help to us. We need skills. Any kind of support, if we can get, we really appreciate, so that we may reach more people. We may go deep down into the community. We really want to save life, so any help we will really appreciate.